Okay. Sorry. Thanks for waiting. We had some technical difficulties, but the show must go on. All right. So I'm just going to do a quick introduction. So, ani bojo, harmony shkak conditioner cause, weekwim kon donjaba, Ottawa nindonji, ginoje dodem, nishna aji nijwaswe na dispa bonwe. So, hello, I just said in Ishnabu, Moen, that my name is Harmony Shkak again. I'm from Wikwemikong, an unceded reserve on Manitoulin Island, but I live here in Ottawa, that is also unceded and unsurrendered territory of Algonquins. My clan is Pike, and I'm 27 winters old. My co-host Gabby is right over there. Um, she is the founder of A7G. Hey, Gabby, how's it going?
We got a little bit delayed because there was a fire alarm that was going off, but it got sorted out. But hey everyone, Ani Tanse, Gabi Nitsukason, Pagchahanse Otsenia. Um, yeah, so hey everyone, my name is Gabby. I'm originally from Alberta. My family comes from Fishing Lake Métis settlement, but I'm a guest here, very far away from Alberta in unceded, unsurrendered Algonquin territory. I'm one of the co-founders and one of the helpers with Assembly of Seven Generations, or also known as A7G. And we've been doing a lot of work during this pandemic to support young people, to get the right information to young people so that they can make really good decisions for themselves and their families. And so, as like Omicron, manifested itself, there's a lot of concerns and a lot of unanswered questions and a lot of like mixed messaging. And so we really wanted to have this conversation with you, Dr. Evan Adams. You really came through in the summertime, and we did a really cool webinar demystifying myths about the COVID vaccine back then. And so yeah, we just wanted to bring you back again and kind of like just help us offer us some guidance. Like, we have so many questions, and a lot of Indigenous youth that we work with have so many questions also. So, anyways, I think it'll be really good, and we're happy to have you. And Miigwech, hi. Thanks, Harmony, for holding it down. But I'll pass it over to you, Harmony.
Perfect. Um, did you want me to start asking a question, or should Dr. Evan Adams introduce himself? You want to introduce
Oh,
yourself to the
sure.
audience? Yeah.
Yeah, I'll say a quick hi. Harmony and Gabby, thank you so much for having me on today. There's so much to talk about. I mean, COVID has been affecting us for so long, and I hear from some people, not all people, but I hear from some people, how hard it is. And I know that I get lots of questions every day about COVID. And I'm really happy to try and help because I want you to do well. And I just want to say how nice it is to see you, Harmony and Gabby. I remember when I was a kid, and the old timers, the old people, they used to say how happy it made them to see you, and I'll be like, why? That's weird. But now I can say, oh, it makes me happy to see you. I'm so proud of you guys. Good work.
Chibi Gwedge. It's like you read my mind. It does feel weird, but it makes me so happy. Yeah, I'm really looking forward to this webinar. There was like a lot of questions that even I didn't realize that I had or was uncertain about. But yeah, let's just dive right into it. So we definitely been hearing a lot about the whole Omicron, especially how it's like a lot more transmissible. But I was really hoping you can explain to us exactly how it is more transmissible.
Sure. So with a virus, uh, they're quite unstable, as in they're not quite living things, and they have RNA, which is kind of a mirror image of DNA, and so it can mutate and break down, or it can mutate and become weaker, or become, even sometimes it can mutate and become stronger. And actually, because viruses like have millions of cycles of reproduction inside the just one person, we do expect that with any virus, it's possible to get a mutation that's a little bit stronger. And in this case, it's not necessarily stronger so much as more transmissible. In fact, in some ways, you could say it's less strong because it gives fewer symptoms and causes fewer hospitalizations and fewer deaths than the previous variant, which was called Delta. But it's this one is so transmissible. Like a lot of people are getting it, and probably some people by now who have had it this last several weeks since December. I know in many places, like we're tracking it from Ottawa. I'm not in Ottawa. I'm in my home territory, but I work for the federal government, and we know that almost 300 First Nations communities have Omicron right now, and thousands of First Nations people have Omicron. Excuse my little dogs; they like to look around and bark. And we don't know what the picture is for Métis because we don't count their COVID cases. The Inuit, we don't know exactly how many cases, but we know in the north there's a lot of Omicron. So it's appearing, and people need to have better knowledge about it so they know just what to do. And I'm going to throw something at my dogs right now. Stop it.
Yeah, thanks for sharing that. I feel like there's such little knowledge about what a virus actually is, and that limited knowledge really creates so much of the misinformation that we hear about. But one thing I was really wondering is how do you see it being transmitted? Like, I know in the past, there'd be a lot of conversation about, oh, like, don't spend too much time with people, and that was like a really high rate of how people were getting COVID. But now it just seems like you could catch it anywhere. So I was wondering if you had anything to add to that.
Oh, thanks for asking. I know it's really stressful for people that our knowledge is changing and our recommendations are changing about COVID. I know. I just want to acknowledge that for some people it's stressful, and it's hard for them to take in some new information. What we do know now is that Omicron is transmitted largely through air. Like it's not very easily transmitted by touch, and it's not transmitted by water. Like you can't catch it from drinking water from near someone who has COVID. So yeah, it's mostly via air. And for many of us, we live quite close to other people. So if someone brings it into the house, a lot of people in that house can get it. Maybe even almost everyone. But it's definitely possible for you to do something to protect yourself if someone in your house has it. Because let's say the 17-year-old comes in and they have COVID, and then let's say there's mom and dad in the house, and let's say mom has poor health, and so you really want to try and protect mom. You can tell the 17-year-old, stay in your room. You have to self-isolate while you're sick. We'll bring you food, and you can get a separate bathroom. It's possible. We'll keep as much distance between you and mom as possible. And mom, you don't go over there and look after the 17-year-old. Dad will do that. Dad will go between the two of you, and we'll try and keep mom well. And that way, you can actually not have it spread to the whole household. The big risk is to dad at that point because he's interacting with the 17-year-old. But usually, because Omicron and that's very important, usually the course is mild. So the 17-year-old, won't necessarily need medical support or go to emerge or stay in hospital or be in ICU. Often, they just feel bad, and they can have a headache and sniffles. Lots of them are complaining a cough that keeps them awake. They feel really sore. So there are things, you make sure they have medicine to help them cough less, medicine so they feel their aches less, medicine to dry out their nose. Um, and then of course you give them everything they need to try and get better, like sleep, let them sleep well, and just check on them, make sure they don't get worse. So anyway, this Omicron can spread to many people in the family, and we just have to remind families, you're probably going to be okay. Most people do fine. They get better in a week, but you have to do a certain few things, like I've just described. Make sure that person is fed and looked after, and you check on them. Don't just leave them alone in their room, and make sure they feel reassured that everything's going to be fine. And if things do get worse, they have lots of trouble breathing, or they just feel so bad, um, and they might need medical attention, to go to Emerge or a family doctor, usually to Emerge if they're having problems breathing, and then they can be supported there with lots of different interventions. But luckily, we're seeing that the complication rate and hospitalization rate from Omicron is low, but especially if you're vaccinated. And of course, the more doses you have, the better. Like 3, if you've had 3, that's amazing. Some people only had 2, some have only had 1, but it's never too late to try and protect yourself, not just yourself, but those who are most at risk. And I think those who are most at risk, those who already have illnesses, long-term illnesses, older people. My dad and mom are in their 80s, and I'm really careful with them. I tell everyone, you have to wear a mask if you're going to go and see them, because my nephews and nieces, my parents' grandchildren, want to go and see them, and I say, yeah, I know, of course you want to see them. It's been a long time. But don't take your mask off, and don't be hugging them and giving them COVID right now. We want to protect them as much as we can. So all of those usual things around staying home and trying not to be too close to each other, or trying not to go to places where you might encounter people with COVID. Those are all still things that we're thinking about. Oh my God, I'm going on and on, eh? Let me let me stop, and you can ask me another question.
No, that was good. You did answer a bit of my question. I was just hoping how you can also confirm some ways to stay safe against the new variant. I can't stay home. I'm not that privileged. I have to go to work, so I'm definitely around a lot of people. So I was hoping if you can just like maybe say it again or just remind me how I can stay safe when, I have to interact with the public.
Sure. Well, just a reminder to everyone that if you're feeling sick, you have to stay home. And even if you get a rapid test that says, if you're feeling sick and you get a rapid test that's negative, you still have to stay home. You're not allowed to go to work if you're sick. Even if you're sick with a negative test, you still have to stay home. But if you're, you go to work, and I have kids too. They're going to work. My only daughter, is a cashier, so she's seeing lots of people, and so I always remind her how to be careful, maximally careful. Of course, the best thing you can do is stay home all by yourself. That's probably the safest, but so many of us can't do that. So when we're in situations where we might get close to someone, like less than 6 feet or less than 2 meters, you should always wear a mask. Like if there's going to be a chance, and of course, in the workplace, there's always a small chance someone's just by accident going to get too close to you. We're careful with our surfaces. We're cleaning and wiping things down, especially if people are touching things that are near us, like places where you might eat, or they might eat, or where they're going to the same place as you, like the bathroom. And of course, we don't touch hands. Uh, no shaking hands, and no hugging. Even if you're masked, you're trying to stay 2 meters apart. Uh, so those are some of the main things that you can do. It's just the usual stuff, and we remind people, do try and stay away from places where there might be a lot of COVID. Yeah, so like Las Vegas, where there are lots and lots and lots and lots of people, or at the mall, lots. You might want to be really, really careful when you go there. So yeah, just those are some reminders. I'm worried that you guys having a fire alarm still over there? Are you still having some
No.
alarms going off?
So I did have another question. Like, as Gabby mentioned before, as a young person like myself, just try to navigate all this misinformation can be really frustrating, especially in this uncertain times. And I know other young people have told us that they're feeling really confused because so many of the mixed messages. So I was really hoping, where can we go to find the most reliable sources of information right now?
Well, every provincial territorial government has a specific site. They're usually really good because they can give you the rules in your province or territory because they're different from each province to territory. I live in BC and I know ours are unique. So it's good to go there. A lot of the information is very, very similar. So for instance, some people are hesitating around vaccination or getting confused around vaccination because they don't know about the vaccine safety. Has it been tested on people? And so that information can be there, and you can go and have a look about the latest information we have around its safety profile. And I just want to remind everyone that no medicine has ever been more scrutinized or watched over than this vaccine. So if there's a problem, you're hearing about it or you're going to hear about it. And we're so lucky that this medicine has so few side effects. So just recently, I was talking to my cousin, and she was worried that the vaccine would hurt her, and I had to remind her because she has immunity issues that she should really be more scared of COVID than of the vaccine. It's actually safer to be vaccinated than to get COVID. And some people worry about the side effects, and so side effects can be listed at those sites as well. And um, the Center for Disease Control, it's really the US Center for Disease Control, is also another good site. And our federal government, Indigenous Services Canada, has some good information that I've been helping to develop along with many, 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 many others to remind people about the things that they need to know. And as far as side effects, they're very what I would call mild. You can get a sore arm, you can get sore muscles. Some people feel tired and sleepy. I know for some people that's a big deal. They don't feel good, but for me it's like, well, given that choice or being in ICU, I think I'd much rather have a sore arm for a day.
No, I am definitely the same. I would much rather just have a sore arm than have to go to a hospital. Um, Thank you so much. That was actually really informative. I'm definitely gonna go look those up after. So my next question was, where could we? Oh no, how does the new COVID therapeutic treatments work? I would be really interested to know more about those.
Yeah, there are two new treatments that were recently authorized. One is an antiviral medication, and they're both fairly new medications, but we've been investigating them, and Health Canada has studied them and given their okay to be in the public domain. They're so new that there isn't a lot of supply. Like it's only just been started to be delivered in Canada in the last like days. And the other is called a monoclonal antibody, which is uh, it's almost like an immune support, it's like immune factors that you can put into your body to protect people in particular situations. Both of those are hard to get, and they're only given in particular situations, and particularly the antiviral needs some specific situations, like if you have any kind of liver trouble or problems with your kidneys, you may not be a candidate for that kind of medication, but they're there. And that's really reassuring to have. So like my cousin who has an immune disorder, where her natural defenses against infection is not good. It's good to have those medications nearby in case she gets infected and she's having a hard time.
Wow, thank you. I had no idea. That's so amazing. I'm sure a lot of other youth had no idea either. Um, so I have a pretty fun question. I hope it is. Like, what are your hopes for the years ahead?
Well, the world is really changing. And I know for some people, change is really hard. Some people really mourn what used to be, and they think of that as the good old days. And I understand that. Like I used to like um, international travel. It's very hard to do that now. But I was speaking to a friend of mine. Actually, her name is Dr. Nell Wyman. She's a First Nation psychiatrist. And she was saying to me, the planning and imagining of a vacation is most of the fun. In fact, sometimes it's even more fun than being there. Because, when you're actually at your vacation destination, sometimes it's hard because there are like bugs, or maybe there's bad weather, or, it's maybe expensive. And so I really took it to heart when she said the planning, it's the dreaming that is amazing. And so I've taken to that. And same with um, not being able to visit with people. I love my parents and I love my kids and I want to see them. I don't want to get COVID and I don't want to expose them to COVID. So it's like, okay, I miss them. So how can I visit without actually physically being there? And so we arrange all kinds of ways to visit, of course, over the internet. But another way that we visited in the summer, for instance, was we put tables out in the yard, and you weren't allowed to leave your table. You had to stay at the table, and there was food on the table. That way, you wouldn't get close to people who were outside of your bubble. So my household would sit at one table, my sister's household would sit at another table, my mom's household sit at another table, and gosh, that was nice. And we didn't mind yelling at each other. It was actually pretty funny, and it made us laugh a lot to do it that way. So it was just such a nice surprise, and it really reminded me how much seeing our loved ones is part of our wellness. So don't ignore it. I know some of you are a bit nervous, but do keep looking for ways to be together and warm your heart and look after your emotional self and your spiritual self, not just your physical self. And I'm acknowledging, and I hope you are too, that this is stressful. This is sometimes pretty awful. And I just say it, it's like, yeah, today was awful. I hated not being able to see my sister, or I really miss the beach today. A international beach like Mexico. I miss seeing my friends in Hawaii, and you just acknowledge it and say, well, it doesn't feel good in the time of COVID, but I'm going to keep going. I have no choice, and in fact, I have lots of things to be thankful for. I have good health. I still have my parents. I have a way to be safe. I'm so glad for the vaccines. Um, One of my friends got COVID, and she was really feeling sad. She said, "I have to stay home for 5 days, and I feel bad." And I said, well, imagine if you hadn't had your vaccine. Like, you should be thankful. And 5 days is not the same as staying home for 10 days, so you could be happy it's only 5 days. Just trying to find ways to cheer her up and cheer ourselves up, because I know it's hard in COVID, but COVID is here, and we have to make it. And who knows what the world will be like in 2 weeks? We're really hoping that the crest is over and that things are going to change after Omicron reaches its peak. I should say we are wondering if Omicron has reached its peak amongst First Nations people. Remember, we're not good at measuring Inuit COVID or Métis COVID, but we're good at measuring First Nations COVID, and maybe we're reaching the peak. We're looking every single day. We look and we think, are the numbers dropping today? Are the numbers dropping today? So I'm looking forward to seeing today's report about how much COVID there is, and I'll be the first one to say to people as soon as I know it. It looks like this wave, the fifth wave, seems to be going down, and I want everyone to stay hopeful. Don't give up yet.
Wow, thank you so much. Just from what you said, I think it really like brings the essence that we're trying to do with this webinar. It's like called COVID-19 community care. And even though we can't really be in community, I miss powwows. I always tell Gabby I miss feasts. I'm always talking about food. But yeah, I like how you mentioned how we can still do it. It just has to be in a different way for now. Like we can do it virtually at A7G. We always meet virtually online. That's definitely been really helpful for my mental health, as well as I'm sure a bunch of other youth. I haven't been back home in 5 years, so I could definitely always miss my mom. I get homesick, but I can always call her up. She never stops talking. She's probably watching right now. Sorry, mom. But yeah, I really like what you said about keeping your head up, being hopeful, and also staying gratitude. I think that's also really important because that's what I was always taught when you have your sema to just be thankful, and you can also pray for whoever's like in your life that might need healing. So yeah, I just wanted to really thank you for that.
Oh, you're welcome, and it is a good reminder for us to think of others. I know some people are having a really hard time. I'm having a hard time, but some people are having a really hard time, and maybe their health is challenged, or maybe they're not coping really well. And I should remind people that to cope, besides feeling gratitude, we can do the basics, which is trying to eat good food. I'm so glad you mentioned food. I love food too, and sometimes I get embarrassed talking about loving food, but I do try different things all the time. It's a nice thing that I can do for myself. So having the best food that you can. Also, of course, staying hydrated. Water is medicine. Getting enough sleep. It's hard to feel better without physical activity. Like we should try and get some exercise if we can. And then, of course, to control our drinking and smoking if we can, because those are ways that some people cope, but sometimes they have side effects that go with them. Sometimes there can be like a negative aspect to those, so we need to kind of keep them in balance. So just a reminder, everybody knows all those things, but it's something I have to remind myself every day. Like, oh, eat properly and make sure you have some water. You haven't had water for a while.
Really, that's really reassuring. I'm sure to me and many other people, because I definitely not drinking as much water as I should, and water is life. Thank you.
Yeah, and I find too that I need quiet time. I like just to sit quietly and be peaceful. And I'm always looking for something that I think is fun. Like having fun is completely normal. And so I'm always looking for like little projects. Oh my God, like at the moment I'm making a little box. You can see what color it used to be. This is to hold a gift that my sister gave me. That's so lovely. See if I can find it. It's a necklace that she got from New Zealand, and it's so precious to me that I thought I would make this. And of course, painting a box is completely silly, just like kicking a ball or playing with the dog. It's not that important, but it's something that maybe for you is really important and really nice. And so I think that pursuit of pleasure, that doing something that only you like, doesn't matter what anyone else says, it's really key to keeping your peace of mind. I really encourage it for people.
Aw, I love that. Yeah, if you find it, definitely show us. I have 4 cats, so I definitely love hanging out with them. Oh, I see it. Nishin, ever cool.
Nice.
Yeah, this is my sister gave me this, so it's very sentimental for me, and I really respect being sentimental because you know I didn't get here by myself. My sisters really helped me along the way, and so this gift reminds me of what a treasure they are and how kind they are to me. And so I wanted to find a little box to keep it in that you know will protect it for forever and ever. Because one day I'll you know give this back to someone else in my family, and they'll have my this nice little box. I'm such a dork. I hope you all dork out too.
That's awesome. We do have some final questions. Did you want to ask one, Gabby?
Yeah, for sure. Um, yeah, I'm in like a building and they just like had to have their fire alarm testing right now. Oh my gosh, it was wild. But but I could hear everything you guys were talking about, and yeah, it was like really reassuring. And I was just thinking like it is so scary. Like when Omicron first came about, it was like so nerve-wracking and scary, but just like listening to you talk, it is reassuring that there's medicine and the vaccines, and there's a lot of really good work that's gone on. And so that was really nice. So I just wanted to mention that I really appreciate that. But we did have a Q&A last week with Shania Clark, and she's a nurse from Northwest Territories. And she shared a lot of like her experience during the pandemic as a nurse. And then we had some youth that had questions, and she kind of like reverted them to you. So one of the first questions that came up during last week's Q&A was about how the vaccines may or may not impact fertility and menstruation, because I know there was like that report that just came out recently. So yeah, if you have anything to share about that, that'd be really great.
Sure. So this is a really common question. We noticed from observation, we like those of us who watch over vaccine effects, that some women, not very many, but some women were saying, my period changed a bit. You know, maybe it was a bit longer, maybe it was a little bit heavier or lighter. I don't know exactly the changes, but they said, yeah, it seemed to change my period. Um, and but it wasn't very long lasting. Like their period would return to normal. It's what we found in follow up. And having your period is related to your immunity. It's actually your immune system that triggers your menstruation. And so it's not surprising that it would change your menstruation. But there's no evidence that it would change your fertility. There's no evidence that it changes anything else than that mild effect, short-term effect to menstruation, or the output of blood, the shedding of the lining of the uterus. So it's very safe, but I can understand the concerns, because most of us hold our ability to have children as sacred. And also, we have very low, we call it tolerance, for like any effects to an unborn child or effects to birth. And it doesn't have any effects, but for most of us, it's like, yeah, if there's any chance of that, I won't get it. What we have found, though, is that pregnant women actually do worse than when they're not pregnant and they have COVID. So being pregnant and having COVID you do worse than if you're not pregnant and have COVID. There's something about being pregnant that gives you special risk. So we're actually telling pregnant women now to get vaccinated. There's no risk to your pregnancy, but there is risk to you if you get COVID. Ditto with breastfeeding. With breastfeeding, you do give some passive immunity from your vaccination to your child through breast milk. So it's actually, again, protective. So you can have your vaccine while you're breastfeeding as well. So those are two very common questions that we get. Is it safe to be vaccinated around concerns of fertility and during pregnancy and during breastfeeding? And then the next question we always get is it safe for my child to get vaccinated? And yes, it is. It is safe for children to get vaccinated. Health Canada gave authorization to those, and it's definitely safe for adolescents. And the majority of Canadians are getting their teenage children and their 5 to 11-year-olds vaccinated in a good way. Thanks.
Cool. Thanks so much for clarifying that, and just being so open to talk about that. We do a full moon ceremony every month, and so I think this will be a really cool topic of discussion in February. Just to like alleviate some of that nerves or fear with some facts. And I guess that's a good segue into another question that came up. And so some of the youth, and I guess like it's kind of working itself out in the media right now, or in government right now, but a lot of folks are wondering if we'll be required to get boosters.
Oh, boosters for teenagers? Is that the question? Or boosters for
Everyone.
Okay. Yeah, so booster number 3 has been authorized and is recommended for those 18 and older, for all adults. So that's vaccine number 3. And the booster is not yet recommended for children and youth up to 17 years old. Not yet, but it may be authorized or recommended very, very soon. At the moment, actually, it is the booster number 3 is recommended for youth, adolescents who have chronic diseases or immune issues. That was just decided and recommended last week. But for everyday youth, booster number 3 is not yet authorized. In the future, we do expect that we will need boosters for any kind of variant of concern that might be emerging. And we're just looking at if a booster number 4 will help us with Omicron. I can kind of guess which way it's going to go, but it's not yet fully decided. So I would say which way it might go, because what if I'm wrong and it's just a guess. It's not solidly recommended yet. So basically booster number 4 is just being talked about. It's not real quite yet for Canadians.
Cool. Thanks for that. Yeah, I got my booster, so I feel really good about it. I'm also type 1 diabetic, so I'm even at more risk if I was to catch COVID. So I'm doing all the precautions, wearing my N95 masks. I actually got these ones from Wikwemkong. Folks over there making KN95 masks. So yeah, I really appreciate your insight.
Oh, yay, Wiki. I was lucky enough to go to Wiki. What a beautiful place. I certainly recommend everyone try and get there. You just reminded me that I was looking at a study recently around um, new diagnoses of diabetes uh, with uh, with COVID. That some people, when they got COVID, they got diagnosed with diabetes, and it does seem to be related to that. If you have diabetes, there's more risk to you. With diabetes, you can be a little bit sicker if you get COVID, and it's related somewhat to your immune system because your blood sugar. Diabetes is a disease of blood sugar. Your blood sugar and the immunity that you carry in your blood are related. Just like I was talking about immunity and your menses or your period are related. So yeah, our immunity is affected by COVID, and maybe even by vaccination, because vaccination prompts your immune system to gear up and learn how to fight a COVID virus if you should ever get it. Hopefully, I haven't geeked out too much in describing that, but it is a reminder to us that people who have other issues can be a little more deeply affected by COVID infection than others who don't have those other issues.
Yes, I agree. I really agree with just keeping everyone safe as much as we can, and we all play a role in that. So it's not just taking care of ourselves, but it's how we take care of ourselves takes care of the whole community. Um, so
Yeah, some people think Omicron is mild for everyone, so they just say, "Oh, well then let's not do anything. Let's just let everybody get it." And that's really not a plan. In fact, that's no plan at all. Just let everyone get it. We do have to protect, especially our most vulnerable from Omicron. Yeah. So Gabby, if you were in my family, I would say like, you guys, if you have symptoms, you stay away from Gabby because we have to protect her. Or like with my parents who are older and maybe more frail, I say, yeah, maybe there's lots of Omicron everywhere, but we still have to fight to make sure my parents are safe from people who might have it.
thanks so much. I appreciate that. Harmony, did you have any more questions?
No, those were all my questions that I had. I was just really honored to meet you virtually. Hopefully, we can both go to Wiki soon.
I would love that. It's so beautiful there. I couldn't believe how many lakes there were that we were passing over to get to your home territory. It's really quite something up there.
Yes, we're surrounded by Lake Superior. It's like the world's largest Great Lake island, freshwater island, I believe.
My husband's also from Wiki, so we'll definitely all have to meet up there.
Canada is so beautiful, and I so miss it. Last summer, I got an RV because I thought, maybe if I just travel, 100 miles over there in my RV, that will feel like, going to Hawaii or something like that. It was pretty nice. So I hope you guys are finding ways to be out on the land safely. You can definitely still go in your territory as long as you're careful about who you might encounter there.
Yeah, we've been doing so much land-based stuff this year. It's been really nice. Yeah, and we also traveled across the country this summer when were a little bit more contained. But we kind of just like kept to our little car and our little crew and didn't interact with too many folks. But we got to see some beautiful landscapes, the mountains, some of the Great Lakes. So yeah, I guess
Uh,
going back to what you were talking about, like looking at the good things, that's been a really great thing for myself and like our crew at A7G is we've just been forced to get out on the land. and we've done like hide tanning. We've learned how to take quills out of porcupines. We did medicine picking. We did gardening, like all the things.
That's
So
so great.
yeah.
Yeah, some people think they have to stay home, but you can go on the land as long as you do it safely and make sure you're careful about who you encounter. Thank you for that reminder. I did know that. I used to think about that a long time ago, but I haven't thought about it for a long time. So thanks, Gabby. You've reminded me to go outside, and it's safe to look around, especially in my territory. I'm lucky enough to live in my territory too, so there's lots of places I can go, and I know there won't be people, and I'll be happy.
Nice. So I guess we do have one question. Um, oh, yeah, that's a really good question. So yeah, the question is, are there any studies linked between COVID and MS?
MS? No, I haven't heard of any, but now you have me curious. Um, Now you have me curious if there's any kind of association. I wonder if the caller or whoever wrote in has more to that question. Had they heard about a study linking MS and COVID? I would say probably just generally, like I was saying before, anyone with a previous condition can do poorer when they have COVID than someone who doesn't have that condition. So I would worry if someone had MS and COVID together. I would watch them extra closely. But we do that for lots of conditions, and that monitoring, watching over someone, is really important to make sure that they don't go downhill, as it were. So someone close to me has been having health issues. They were fully vaccinated, been diagnosed with uh, optic neuritis due to MS. Huh. I will have to look that up because I've not heard of anything in that regard. Huh. How
Yeah,
interesting.
I think it might be connected to like the what's starting to kind of happen with what people are calling long COVID. So maybe
Oh,
that's like where the link is.
yes, maybe. Long COVID is when people have long-term effects from infection. Originally, we thought that COVID was just a respiratory illness. It just affected cells that are in your breathing system. But then we found that it does have other effects, like in your nerves and brain, and in your blood vessels, amongst other things. And probably it has some weird effects because that's consistent with any kind of infection that you get, depending on where it is in your body. And some places are more susceptible than others. Depending on where it is, it'll have different effects. Like tuberculosis is a disease that usually you get, it's airborne, and so it can be in your lungs, but then it can travel. So that's a really good example, TB, because it can affect almost every system in your body. With COVID, I would say we still don't know what the long-term effects are or which systems are particularly susceptible. But that's such a great question. I should be learning more about long COVID, because there are people who are starting to say, I had COVID a long time ago, I still feel not myself. So, what could explain that? So thanks for the question.
For sure. Yeah. Thanks so much, everyone. Oh, we have another question. So this question is about. Sorry, I'm like taking over, Harmony. Harmony, you asked the question.
Oh, okay. So they just wanted to know, is it important to get the same booster shot as our vaccine? Um, Pfizer.
Oh, that's a good question. I've heard I've heard some people prefer Pfizer, because Moderna has this very small risk. It's really small risk for young people, especially young men, and pericarditis. But there have been hardly any cases of that with Moderna in Canada, like virtually, like less than 10, I would say. So, but some people have heard of this and they're like, oh, maybe I should just get Pfizer instead. Um, some people are thinking maybe I should get Pfizer and Moderna, like of my three, like at least one of Moderna, at least one of Pfizer, and just mix it up, and maybe that'll be more protective. And some people are saying, well, we hear that Moderna boosts your immunity for a little bit longer than Pfizer, so maybe I want Moderna. I honestly think that you just need to take the one that's being offered. It's not like shopping where you go, oh no, I want that one. I don't want that one. I guess you could try, but yeah, definitely I've heard from some people that they want to go a particular way or not. I had 3 Pfizer, and part of me was thinking, oh, I'm a little bit of a like, oh, let's just try everything. I thought it would have been cool to get Pfizer and Moderna, but I've only had 3 Pfizer. I don't think it's that. I don't think it's going to change a lot which particular ones you receive. But chances are you probably got a Pfizer in there, because there's definitely more Pfizer in Canada than Moderna.
Thank you for your honesty. Yeah, I think I got mine mixed up just because I had whatever was available. I was pretty lucky because in December, when everyone was booking appointments to get your booster shot, I didn't have a phone, so I actually wasn't able to call. But thankfully, the Indigenous clinic here in Ottawa, they allowed walk-in. So I was really fortunate that they were able to make it a lot more accessible for like youth like me that don't really can't afford a phone, or at least can't pay their monthly bill on time. So yeah, I just wanted to thank you for all your honesty. I learned a lot. I think I'm not gonna be afraid to doom scroll anymore and just like be like a dork and actually like do my research.
Yeah, I think it's important to be honest, and I think that's our way. Like I'm not supposed to lie to you, and actually, in my culture, it says if I lie, you can tell. So it's way better to be honest, and so I do try just to be really straightforward with people. And I know it would be easier if I was really decisive sometimes, but I think you deserve, absolutely, you deserve honesty, and you deserve the truth. So to both of you and to anyone else who might be watching, yeah, don't be afraid to look around. Just make sure you find a good place, and don't be afraid to ask me. I'm on Facebook, so you can send me questions. I'd rather you ask me than some you know doctor in Texas, or some, that who you don't know. Hopefully you all know me and you trust me. Thanks.
I appreciate that. My peers like to call how I live my life the Métis fairness rule. So that's like something I learned from my auntie. You can't cheat at cards or games. You have to be honest, and yeah, you can't do any of that, or else I'll come back and bite you in the butt. But
Yes.
before we let you go, I just wanted to say thanks so much, and it was really great to hear from you. And like even though there was like a fire alarm going off in the background over here, I still feel like very like calm and like reassured by everything you said. So it was really great.
Ah.
And someone also wants to, they don't have a question, they just wanted to say, hey, what's up?
Yeah, don't be scared. Just be prepared. Yeah, don't be scared. Don't be scared. So thank you both for all your work in helping people not be scared and to get more information. And it is important for us to reassure each other and remind each other we're going to be okay. We really are. But we still have to take care of things.
Thanks so much. Miigwech. Hi. Thanks for being with us tonight.
Thanks so much. Take care.
See you later.